The skin and mucous membranes of every human being are colonized by various microbial species. When hospitalized, patients gradually shed these microorganisms onto inanimate objects in their immediate surroundings, for example, onto bed linens, gowns, and bedside furniture. Hospitals contain a multitude of environments. Some of these, dubbed patient zones, consist of a patient and his or her immediate surroundings. As a result of contamination by both healthcare workers and patients, other areas of the healthcare setting, such as corridors and public areas, are also colonized with microorganisms, though to a lesser extent than patient rooms. Cross-transmission of potential pathogens from one environment to another occurs through healthcare workers' hands. Hand hygiene greatly reduces the risk of cross-transmission by this route. Healthcare workers must perform hand hygiene immediately before touching a patient or when entering a patient zone. This will prevent cross-transmission of microbes from one patient to another. The correct moment to perform hand hygiene before touching a patient is critical. Hand hygiene should be performed close to the site of care in order to avoid recontamination should your hands inadvertently come into contact with an object distant from the patient, the doorknob, for example. Perform hand hygiene between the last hand to surface contact with an object located outside the patient zone and the first within the patient zone. You should also perform hand hygiene just after touching a patient and before touching any object located outside the patient zone. This will limit the risk of germ dissemination to the healthcare environment. Even if you did not touch the patient, perform hand hygiene after touching objects located in the vicinity of the patient. For example, perform hand hygiene after touching a monitor, bedside table, or bed rail, since these may also be contaminated by the patient's microbial flora. There are body regions that must be kept as free of microorganisms as possible. These include zones of impaired host defense, such as breaks in skin and mucous membranes, surgical wounds, for example, or sites of invasive device insertion, such as vascular or urinary catheters and endotracheal tubes. Microorganisms that colonize the healthcare worker's hands, the patient's skin, or immediate surroundings must not be introduced into these zones of lowered immune protection. For these reasons, perform hand hygiene immediately before touching non-intact skin and before manipulating invasive devices. This will prevent colonization, which may subsequently lead to infection. Examples of critical procedures include wound care, tracheal suctioning, removing the dressing of a central venous line, giving an injection, and lumbar puncture. Finally, hand hygiene helps to protect the healthcare worker. Some patient care activities may expose healthcare workers to potentially infectious pathogens. In consequence, perform hand hygiene after contact with body fluids, mucous membranes, non-intact skin, or wound dressings, even in the absence of visible soiling and even when gloves have been used.